My name is Michael. I am a surgeon at St. Mary's Hospital, and for a while now I've been having some uh, problems at work. Um, and with that, I mean by showing up hungover to work, which it has uh, been affecting my job performance and my relationships with the people that I work with. So my manager has asked that I be assessed to determine whether or not I do indeed have a substance abuse problem with alcohol before I can continue uh, working again. So this is kind of where we are at now.
I'm Jennifer. I'm the therapist that St. Mary's recommended Michael to. And this is his second time coming to see me. And after our initial assessment, I have concluded that Michael does indeed have a substance abuse disorder. And today we are working on goal formation and intervention planning to make sure we get Michael the treatment he needs so that he doesn't lose his job and lose his opportunities. Welcome back, Michael.
It's good to be here. Thank you.
No problem. How are you doing today?
I'm doing okay.
Okay. I know it's been a week since I've seen you. How have you been doing?
Just working. Kind of been cleaning up a little bit around the house, doing some spring cleaning, and enjoying the weather that we've been having.
Yeah, we got to take advantage. It might get cold again, given the unpredictability of that. Okay. So after we met up last week and I got the chance to talk with you, I'm going to conclude that you do have a problem with alcohol. I wouldn't venture to say that you have a full-blown addiction, but I do believe that you need a little bit of an intervention to help you get your life back on your feet, given that your alcoholism seems to have made your life unmanageable. That's a clear indication since your employer has noticed you coming into work hungover and you haven't been able to meet your duties. So would you agree with that you probably do need a little bit more help with that?
You mean, are you recommending hospitalization for?
We'll get to that. I'm trying to make sure we're on the same page about you possibly having an addiction to alcohol. Okay?
Well, I definitely do like to drink. It calms me down. My job is very stressful, so I guess whenever I think back, when I look back, I like to drink every day, so I can see where that would be an issue. It is becoming a problem with my job, which is what I do. I can't be hungover or potentially still drunk at that point too. So yes, I can see how it is becoming a problem.
Okay.
That needs to be worked on.
So what would you like to get out of our sessions here?
I would like to, first and foremost, get help for myself. If there's advice that you can give me today would be greatly appreciated. Would like to keep my employment, and also I would like to see my 6-year-old son Thomas more, who I currently am only allowed to see every other weekend just because of legality issues and with the divorce and my work schedule.
Okay.
But I would like to see him a couple times during the week on my weeknight that I have off. However, my ex-wife is only agreeable to this if I control my drinking.
Okay. So your ex-wife is supportive of you getting some treatment for your alcoholism? Mm-hmm. Okay. All right. So am I understanding this right? What you want to do is you want to find some tips and some ways to get sober and stay sober so that you can maintain your job and so that you can also be allowed to see your son more often? Mm-hmm. Okay. So we got a couple of options with this. I want to ask you, you mentioned that you would like to drink daily, or you feel like you would like to drink daily. Have you been drinking daily?
Yes.
Okay. How much a day do you usually drink, Michael?
Maybe 6 beers on a weeknight, a little bit more on the weekends.
Okay. So are you sticking with just beer, or are you going with hard liquor, or anything like that, or is it just a 6-pack?
It just depends on what kind of day I've been having. It's usually a 6-pack of some type of beer, and then weekend it's usually a little bit stronger drink.
do have a recommendation that I usually make for anyone who comes to see me that is having a problem with alcohol, is that you seek medical treatment in order to get a detox off of the alcohol. Since you're drinking every day, your body builds up a tolerance and it builds up a need for that alcohol, and it could make you really sick to stop on your own. Do you notice when you don't have the alcohol for a while that you do get physically sick?
Well, yes. Right now I'm starting to get a headache and shaking a little bit. I haven't drank in a couple of hours.
Okay. I would definitely recommend them, Michael, especially since you work with St. Mary's. I'm sure they would be willing to help you get that medical detox, or if you would like to not do it at a hospital that you work at, strictly because you don't want anybody else to really be aware of the problem you're having.
I would,
doesn't.
I would prefer to do it at a different program outside of St. Mary's. That's an option in this area.
We can get you set up for that. And in terms of your goal of getting sober, we've got a couple of options in that department as well. You can consider an inpatient treatment program. Most of the ones in this area last anywhere from 20 to 30 days.
Okay.
If you choose to do inpatient, you'll be there 24/7 and you cannot leave, so you won't be able to work while you're there. So that's something to take into consideration, but they will provide you with the tools necessary to remain sober. And they'll get you involved with 12-step meetings and AA if you're interested in doing that. Or you can do, we've got a couple of outpatient treatment options. Outpatient is going to be a little bit more versatile. You can have meetings during the day, you can have them in the evening, you can have multiple times a week. So if you do that, we might be able to keep you working while you're getting your treatment. Do any of those sound like a good idea to you?
Definitely the inpatient sounds a better option.
Okay.
The first step for me to do.
Okay, so you think you would benefit mostly from inpatient?
Yeah, I just at this point, after just going into an outpatient that meets for 3 hours, 2 to 3 times a week, I don't see that doing anything for me.
Okay.
Because I would still be working. And I don't know.
You think maybe you need to take a break from being in the work environment? Because if you do the inpatient, you can at least get a little bit more time to focus simply on yourself while you're there.
I think that's what I meant to say, because with outpatient, they would be telling me not to drink, but then I would still be working during the day and still be stressed out, and probably still be drinking in between those meetings. So I definitely think more inpatient, intense hospitalization program would be beneficial.
We can get you set up with something like that. And the benefit of that as well is you'll also have a therapist that will be on hand there, and they will be keeping an eye on you while you go through treatment there. And if you're interested after you get out of inpatient, you do always have that option of attending those meetings. That the intensive outpatient treatment meetings are 3 days a week, as you mentioned, 3 hours each evening. And you could do that after inpatient. Okay, so that could be the first step that we will take in order just to get you sober. So before you leave today, I'll give you the paperwork you'll need to maybe go to Deaconess or maybe one of the other hospitals close by to get you that medical detox that you need. And then from there, we'll get you straight over to an inpatient treatment center. And after that, I'll make sure that they're aware that you are interested. Are you still interested in the outpatient treatment?
After inpatient,
okay.
I'd be willing to do that as well.
How about St. Mary's? Are they going to work with you if you do inpatient treatment?
I think so. Yeah.
Okay. That's one of our other goals. We don't want you to lose your job. Okay. So what other steps, Michael, do we need to take to get you to see your son more often? Do you have any legal issues right now or anything pending?
No legal issues. It's
just getting you sober.
Yeah.
Okay.
The wife doesn't feel comfortable with me being around. Ex-wife doesn't feel comfortable with me being around our son as much because she doesn't feel comfortable with me drinking and having him in the home.
That's understandable. Since it might take a little bit to get you into a medical detox program, it could take a couple of days, or we could just take you to the emergency room. But if you have time before entering into that program, I would suggest that you remove any alcohol from your apartment or house. And make sure all that paraphernalia, anything that reminds you of that, get rid of that. Or if you have somebody that is willing to go to where you live and remove that stuff for you, that could be an initial step. And then we can definitely get you over to the hospital as soon as possible. And I believe that St. Mary's also has an employee assistantship program for their employees if they're having a substance abuse problem and require treatment. Is that something that you're aware of? Okay. So I will get you the paperwork for that as well before you leave today. Is anything else going on in your life right now, Michael, that you want to talk about?
No, I'm just tired of feeling that I have to depend on alcohol to get me through each day. I'm tired of feeling like crap in the mornings because of it. Otherwise, doing okay.
Okay. That is good to hear. Michael, we're going to do everything we can to help you take care of that problem, okay? If you don't have anything else, I think that's all I got for you this evening.
All.
All right.